The food served at your establishment makes a long journey that starts at the farm. This journey is often described as farm to fork. From the time the food leaves the farm to the time it arrives in your kitchen, numerous parties, including farmers, processors, wholesalers, distributors, retailers, and government agencies, have carefully guarded its safety. These parties implement measures to reduce, eliminate, and prevent foodborne illness. In the U.S., we have over 2.1 million farms with over 30,000 processing sites that provide business to over 19,000 food packers and repackers who supply food to over 224,000 retail food stores and about 1 million retail food outlets like your establishment. Along every step of the food processing and distribution path, there are food safety laws from different authorities that help protect our food. The U.S. Food and Drug Administration, FDA, is responsible for protecting the public's health by assuring the safety, efficacy, and security of human and veterinary drugs, biological products, medical devices, our nation's food supply, cosmetics, and products that emit radiation. The federal government establishes the FDA Food Code and regulates different aspects of the food supply. The Food Code is designed to minimize foodborne illness. The Center for Disease Control and Prevention, CDC, is a federal agency that promotes food safety and provides surveillance over foodborne illness outbreaks. When an outbreak occurs, the CDC works with other federal and state agencies to ensure rapid response. The Environmental Protection Agency, EPA, is a federal agency that determines air and water quality standards, regulates pesticide use, and dictates proper handling of waste products. A subsidiary of the United States Department of Agriculture, the Food Safety and Inspection Services, or FSIS program, is responsible for inspecting the meat we consume, including chicken, beef, and related animal products like eggs and milk. FSIS also inspects domesticated slaughterhouses for compliance, sanitation, labeling, and other quality standards. Food safety regulations are written into law at the state level. Some states adopt the FDA Food Code in its entirety, and others modify specific aspects of it. Each state has the responsibility of making sure local authorities perform regular food safety inspections in a uniform manner and enforce state laws during inspection. In Minnesota, the Minnesota Departments of Agriculture and Health have jointly adopted the FDA Food Code. Approximately 250 individuals are responsible for retail food inspections, while approximately 30,000 retail food establishments are licensed and regulated by the Minnesota Department of Health, the Minnesota Department of Agriculture, and local delegated agencies. More than 150 independent food safety instructors provide training for Minnesota certified food managers. Local level agencies are cities or counties responsible for enforcing a state's food safety regulation through inspection. You are most likely to connect with an inspector that works with a city or county. If you have questions regarding food safety, contact your local health authority. A hazard analysis critical control point, also known as an HACCP, is a proactive management system designed to prevent foodborne illness before it occurs. It's an approach that examines each step of the food handling process and identifies potential hazards, ensuring that you implement high food safety standards. At your establishment, you will work to implement HACCP following 7 principles. 1. Conduct an analysis to identify hazards across the process or operation and specify control measures. 2. Determine critical control points, also known as CCPs, to eliminate potential food safety hazards. 3. Establish critical limits such as temperatures that prevent, eliminate, or reduce potential hazards. 4. Establish a monitoring system for each critical control point. 5. Establish corrective action when established temperature limits are not met. 6. Establish verification process. 7. Establish proper record keeping and documentation. These principles can be implemented by evaluating all of the preparation steps for meat, poultry, fish, grains, many raw vegetables, and all cooked vegetable items, paying close attention to the number of times each food will be in the temperature danger zone. You need to analyze the hazards associated with the food and use active control to avoid these hazards. How can you do this? Let's explore some examples using familiar menu items. Vegetable salad. Here, this menu item is prepared without a cooking step. Its preparation steps are as follows. 1. Receive the ingredients. 2. Store the ingredients. 3. Prepare the salad in small batches and quickly using gloved hands. 4. Once prepared, immediately place the salad mixture in a bowl and hold it in the refrigerator at 41 degrees Fahrenheit or less. 5. Serve when ordered. Chicken quesadilla. 1. Receive the ingredients. Ensure the chicken is USDA inspected and fresh. 2. Store the ingredient in the refrigerator at 41 degrees Fahrenheit. Raw chicken should be stored on the bottom shelf of the refrigerator, and tortillas and cheese should be stored on the top shelf. 3. Prepare the chicken, marinating and cutting it in small pieces. During preparation, avoid cross-contamination of raw chicken with other food ingredients by using separate cutting boards. 4. Cook the chicken to 165 degrees Fahrenheit. 5. Hold the cooked chicken at a temperature greater than or equal to 135 degrees Fahrenheit. 6. Prepare the meal when ordered. Beef chili soup. 1. Receive the ingredients. Ensure ground beef is USDA inspected and fresh. 2. Store the ingredients in the refrigerator at 41 degrees Fahrenheit, ensuring beef is stored on the bottom shelf while the vegetables are on the top shelf. 3. Prepare the meal. During preparation, avoid cross-contamination of ground beef with food contact surfaces and ready-to-eat ingredients. 4. Cook the ground beef to 155 degrees Fahrenheit. 5. Cool the chili to 41 degrees Fahrenheit within 6 hours. 6. When a customer orders, reheat to 165 degrees Fahrenheit. 7. Hold the heated chili at a temperature greater than 135 degrees Fahrenheit. Now that you've seen examples of HACCP implementation, you can begin to think about your own HACCP plan. It's wise to divide the food preparation methods into categories based on the number of times a specific food will be in a temperature danger zone and analyze the potential hazards. Then you can use active managerial control to implement food safety steps based on HACCP, as we've done with these menu items.